Good morning. I am Hemanth Manay, CEO of S.R.Gopal Rao Opticians.
Hi, I'm Triveni, the Chief Optometrist and Myopia Consultant at S.R.Gopal Rao Opticians and Optometrists. So just wanted to understand why exactly you chose optometry as your profession.
Well, the legacy of S.R.Gopal Rao, who was my grandfather, somebody had to continue the profession, and I took onto myself to know and understand what would lead to become a perfect optician or an optometrist. So I realized there was a course called optometry at the Minto Ophthalmic Hospital, and that's the time I realized that this is what I should do and I should be. I should become a professional and run the organization rather than becoming an optician and just dispense spectacles. What made you choose?
Why I chose optometry is I could not get into the medical profession. So this is also being a part of the medical profession, always wanted to do some amount of service to mankind. So why it touched me so much is, or why I feel still to continue optometry as my main profession is, initially when we had joined optometry, we were all trained by ophthalmologists. So on the first day in our college, we were made to put blinders for us to exactly feel how a blind person sees or feels. That was very touching, and I said yes, I have to continue and really make a difference. Sir, actually people have a misconception when they say optometrist. They think it's only all about, they know only to dispense glasses. What is your perspective, or how do you want to define an optometrist?
Optometry, as I said, is a noble profession. Now, when we talk or define the word optometry, it is not a job of just doing an eye test or a refraction. When we start, we have a patient in the clinic, we thoroughly diagnose, starting from checking the anterior segment or the exterior part of the eye, the cornea, the conjunctiva, or we check for cataracts. Then if there is any fundus examination to be done, we check that out if the person is diabetic. And then also we see symptoms externally. See, if we see a person with a drooping eyelid, what we call as ptosis, then we recommend them crutch spectacles. See, these are so many other features. Of course, day by day, technology has advanced. So I'm sure you will be in a better frame to elaborate further.
To me, optometry is not a paramedical profession. It's an allied health science profession wherein, it's not just refraction like you rightly mentioned. There are a lot of other things what an optometrist does. Now that we are talking about a detailed or a thorough eye examination, when we see these sort of diabetic patients or hypertensive patients, they all take health for so granted, especially the eye. They think that, okay, I am seeing things clearly, so that means I really don't have a problem in the eye, which is incorrect and not true. You can still have good vision and still have a lot of problems inside the eye. Only when you get a thorough eye examination done, only then the optometrist or the ophthalmologist can pick up the defects in the eye. They can monitor or start you immediately on treatment. Sad part of it is people just take eye health for granted.
I have seen cases, especially the high myopic cases, when we ask them to evaluate the retina annually, and they just neglect it because the vision has been good right through. So they come one fine day with either a tear or a detachment, which is maybe too late. And I've seen cases where glaucoma, as you know, is a silent killer of vision. So they do not know the intensity or the severity of that disease. This is something which we have to change and advise and educate patients across.
I think this is what exactly we are doing at S.R.Gopal Rao in our practice. So any patient who comes, we are asking them to keep all their records as a medical, records. Keep it with them safely and bring it on your next visit, so that we would have written down all the findings, like, what are the changes in the retina, what are the changes in the anterior chamber, or, if there is a glaucoma patient, if there is any cup disc ratio and all. So in case if we feel, there is something which is not right, we always ask the patient to get another opinion with the ophthalmologist.
Since you brought out the subject of S.R.Gopal Rao Opticians, I recall, when I completed optometry and started my clinical practice, it was not just refraction or a screening of the patient. I used to rather do a thorough examination of the eye, ensuring, of course, we invested in equipments. That is our strength, because without that, it's half job done. So equipments along with expertise is what I always believed in. And these are things where, people used to come to an optician thinking that they just come there to buy spectacles. Yes, that is part of the profession, but extensive eye examination is what we were always doing at S.R.Gopal Rao. So this is what I feel, and I'm sure you being the senior consultant now, you can add more light to this.
Definitely, sir. We've still been following the same footsteps. Added to that is what I see in the other outside practice of optometry, and which is different from what we practice, is right from history taking. After that, we also ask all our optometrists to do a basic torchlight examination where you can pick up a lot of findings from that, and then move on to a slit lamp examination. Then your refraction, you can do either your retinoscopy, or you can take a AR reading. Then you do the vision examination. After the correction, I've seen, even where people are giving reading correction binocularly, which is incorrect. At S.R.Gopal Rao, we do it with more precision, take each eye separately, so that we know if both the eyes are functioning 100%.
So I'd like to add, we do not dispense over the counter contact lenses or reading spectacles.
Very true, sir.
Because until and unless a refraction or a thorough examination of the patient is done, only then the dispensing of a spectacle or contact lenses.
In fact, even contact lenses, people just come over the counter and ask me, it just so happened recently, there was one youngster who came, no, I'm wearing one particular company's lenses. She said, no, I want that. I said, no, we are not dispensing that particular brand, which is not a good quality. I deal with only specific international brands which are good for the eye. And she said, no, they just did a test in 2 minutes and gave me contact lenses. I said, no, that's not how it works at S.R.Gopal Rao. We have to do a thorough examination and check what base curve suits your eye to give you that perfect fit and precision in your contact lens vision. In your practice, where you feel, your diagnosis or your treatment has made a change to somebody's life, or where they have come back and thanked you and said, no, I made a right decision of coming to S.R.Gopal Rao.
Well, there are a lot of such instances, but I would like to quote one. There was maybe a 22-year-old young man who came into the clinic. This was in the late 80s or early 90s. He was a high myope, almost -18 and -20, and he was out looking for a job. Because of his thick glasses, the confidence level was very low. Whenever he used to go for an interview, the company would say, how is your vision? Are you capable of doing this? Are you capable of joining our organization? So then he sort of did research and came to us, that is at S.R.Gopal Rao. So I told him, see, vision with glasses, there is a limitation. And at that point of time, we were dispensing rigid gas permeable or PMMA, that's hard lenses. Soft lenses were very, very few. So I told him, see, now that I've checked your eye, your retinal health seems all right, but because of high myopia, the vision is a little limited. I put him onto RGP lenses, and believe me, this man then disclosed in the clinic that he said this was his last resort. He says if he could not get a job again, he would commit suicide. And that moved me. I said, no, this is a man who couldn't afford. In fact, I gave him those contact lenses. I didn't give him free, because free never has value. I took a cost price. And that young man went for the interview, and he got a job the very next week. 80s or the early 90s, which I said, he came back with his daughter 10 years back. And he said, sir, this is my daughter. She's also myopic. He narrated the whole history of his life, and that impacted me so much. I said, thank God. This is someone who always blessed me, this is a memory which was cemented in my practice. I don't know if you have such a
I have a lot
memories.
of them like that with S.R.Gopal Rao and my practice there. Just about recently, about 3 months back, there was a very senior person, probably is about 70 plus. He had undergone a IOL implantation in both his eyes. So he came with a presentation of that he cannot see nicely with his glasses in his left eye, and he had got his glasses.
How long back was this IOL?
IOL was done about 20 years back, sir.
And his vision was good?
Yeah, his vision was fine. He is an old patient of ours. So he came telling me, somehow the glasses what you have given me is not okay in my left eye. I really can't see well. Then I said, why should it be like that when we are taking so much of care in doing a thorough eye examination? So I took him in the clinic and I just, like I said, did a basic torchlight examination. I could see the IOL reflex in one eye. The other eye which he was complaining of, I could not see the IOL reflex, and I was very sure that he had an IOL implant in both his eyes. So after doing that, I said okay, then I did a slit lamp examination only to see the eye look like a fake it to me. There was no reflex of the IOL. Then I did a refraction and he improved with a +6. He was almost reading 6.9. Then I said, no, something is really wrong because the pupil was very myotic. I could not dilate him. So I told him, no, you please go to your ophthalmologist. I feel something is not right with your eye. Then he took my advice. The very next day he went, and it so happened there was dislocation of the IOL. It had fallen in the vitreous. So they had immediately taken him for vitrectomy and removed the IOL, and a secondary IOL implant was done. So that patient came back after a week time and then thanked us and said, thank you so much for saving my eye. Now with the correction what we have given, he is improving to 6.6 parts.
Wonderful.
So that is something which has really made me feel very nice. So now that we are talking of eye health and the importance of it, what is that one thing that you have seen in your practice all these years where people, come asking like, if I do this, is my eye going to be all right? Or something like a myth.
Okay. People come with varied ideas and suggestions, especially, the parents, when they bring their children, they come and ask me, you think it's necessary? I mean, I'm talking of a myopic background child, especially when the parent or one of the parent is myopic. So they come and say, okay, see, I'm giving my child such a healthy diet with carrots, with greens and dals and this and that and all that. And some of them come saying that I'm doing a different sort of exercises, and they have promised me saying that his myopia would be sort of removed or reduced. So is that true? So I tell them, see, genetically you cannot remove myopia. So that is one more thing which we constantly hear. The other thing is, they say eye exercises, look at this, look at that, do this, maybe candle movements or all these things. But every time we have to explain. Of course, what happens, they come with various questions. It is our duty to scientifically explain and make the parent understand that yes, it is good for the eye to do exercises, but you cannot remove myopia by all these factors.
Very true, sir. Same here. Same opinion even I have, at times. Added to this, I would add one more thing, when people have cataract, because they are aged and it's only a process of aging that they are developing cataract. So many of them ask, Madam, yenadru drops idya? Can I put some drops so that my cataract goes away? I tell them, no, there is nothing like that. No drops is going to, remove your cataract. Probably there could be something, some other form of medication, like you said, which can slow down. What is there, you can't undo it, I tell them. So what is that one advice that you would give to your fellow optometrists regarding their practice of optometry?
I wouldn't say advice. I'm sure once you are an optometrist, there are certain things which have been imbibed into you, like when you have a reason to join this profession, which I earlier mentioned, which is a noble profession. Imagine improving eyesight to a human being. What more can an individual ask for? So these are things where an optometrist or even the community at large, I would advise, make sure you have the eye examination frequently done. This is to the community. For the optometrist, ensure that you do a thorough examination, not just a refraction or an eye test like a normal layman would suggest. So these are things where we as optometrists ensure that we become ambassadors for correcting vision or improving vision. And this is a profession which we would like more and more people opting for it. Yes, medical is not for all. Maybe people can't afford, maybe people do not perform to join, but optometry is a simple a +2 or so, and you can join the optometry classes, and you can work all through maybe metros, PHCs, Tier 1, Tier 2 cities. So that gives you a different feeling altogether, and improving eyesight, I feel I'm truly blessed I'm in this profession.
Even I feel the same, sir. I feel you should follow your profession and make it your passion.
Exactly.
Only when you make it your passion, you will be excelling in whatever you are doing.
Very true.